You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
So, you think you have skeletons in your closet? Come to Sternberg Museum, where we let our skeletons out of the closet.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of the West Central Kansas Smart Start Grant. And with me today is Ken Loos. Hello, Ken.
Hello. Nice to see you.
Nice to see you. Now, first of all, tell me a little bit about the organization that you work for and what you do there.
Sure. I work for High Plains Mental Health Center. We are the comprehensive licensed community mental health center that covers the 20 counties of northwest Kansas. Our main office is here in Hayes, but we also have 5 full-time branch offices and also 6 additional treatment sites.
Okay. Now today we're going to talk about, some people have heard about first aid, but we're going to talk about mental health first aid. So what is that?
Mental health first aid, and it's a good thing to bring up first aid. It is a program designed to help people know what to do for individuals that experience a mental health crisis. So like if you think about CPR, comparing that example, if an individual is having a heart attack, after you call 911, obviously, there are certain steps you can take if you've been trained. With mental health first aid, it gives you an idea of what to do when someone's going through a suicidal crisis, they're experiencing a panic attack, they're addicted to substances, maybe they self-injure, maybe they're suffering from an eating disorder or even psychosis where they've lost touch with reality. Of course, calling 911, talking to the professionals, but what can you do in the interim? How can you help folks out?
Now, how is this important, or how does this affect families and children? We talk about children on this program.
Yeah, absolutely. You know, it's kind of interesting that 50% of all mental illnesses begin by the age of 14. 75% begin by the age of 24. And so when you think about that, mental illnesses can start to occur and start to become obvious at a pretty young age. When we think about children, for example, with maybe a fear of going to school, or maybe they're not bonding with their parents as well, we tend to see that in the earlier years. Then depression kicks in adolescence and teenage years, and finally substance abuse is very common in late teenage years, early 20s. And so that's one aspect of it where it's very relevant. The other is, of course, if you think about mothers who suffer from depression. You know, you think about fathers who suffer from an anxiety disorder, depression, substance abuse, that is going to, of course, have an impact on a young child. And so the great thing about this program is not only learning to help others, but maybe also to be aware of their own levels of stress, their own challenges, and what they need to do to take care of themselves.
Now, is there a training? Is that what the program is? And who would benefit from the training?
You know, it is a training. This is the part that scares people away. It's a 12-hour training.
Oh, that's not too bad.
But yeah, it's not too bad, and it's not all at once, so we don't get people depressed and frustrated after 12 hours of just straight stuff. We split that up. It is a public education model, so this is something that anyone could benefit from. We've been real fortunate throughout our counties that folks from law enforcement, the faith community, teachers, paras, really from a variety, EMS, fire, so from emergency responders to just people interested in learning how to help others could benefit from this 12-hour training.
Now, say that you were a parent who had a child with a mental health problem. Would that be appropriate for a parent to take?
You know, it would be appropriate for a parent to take. I think more directly, if you're a parent and you have a child with a mental health problem, certainly getting in touch with professionals and going through counseling. But this program kind of broadens your knowledge base and gives you an idea, again, of what to expect. What does a panic disorder look like? What does anxiety look like? You know, some of us have these certain ideas in our head, and then we're surprised to find out that that's not even the average picture a lot of times, you know. And so absolutely a parent would benefit.
So something in addition to, seeing their counselor or their mental health professional, of course.
Absolutely.
Yes.
Yeah.
Now, if someone wants to get more information on this training, who would they contact?
I'm the individual to contact. I'm based here in the Hayes office, so our local number is 785-628-2871. We also have a 1-800 number, 1-800-432-0333. Again, my name is Ken Loos, but if you just mention to the receptionist you're interested in Mental Health First Aide, by default they'll be sending your call to me. It's coming to me. So.
Now, you mentioned you work for High Plains Mental Health Center, and what is the relationship between Mental Health First Aid training and High Plains Mental Health Center?
It's a good question. Mental Health First Aid is a program nationwide. It's actually a worldwide program, but here in the United States, it's certified by the National Council of Behavioral Health Centers. So this is kind of one of the main organizations nationwide that supports and licenses and does a variety of things for mental health centers across the country. So they've sponsored this program, certified it, and really the first people it was offered to were mental health centers. There are 3 in Kansas right now that have some individuals trained. Again, I'm privileged to be the one for High Plains here in northwest Kansas, but also Burt Nash in Lawrence and ComCare in Wichita have trainers in this program. And the goal is, from a nationwide level, that in about 15 years, mental health first aid will be as common as CPR. Maybe not have as many people trained in it, but if you hear someone say, oh, have you taken this mental health first aid class, people have an idea of what's involved with that course.
Now, give us the phone number one more time.
You bet. Here locally, it's 785-628-2871, and statewide, 1-800-432-0333.
Thank you so much, Ken. We appreciate you being here with us today.
My pleasure.
You've been watching You and Your Young Child, the program devoted to early childhood. Parents, remember, you are your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History.